Virginia Free CNA Practice Test with Answers 180 Questions Full Guide. Question 1. The treatment of obesity is called what? Option A, pediatrics. Option B, geriatrics. Option C, bariatrics. Option D, obstetrics. The correct answer is option C, bariatrics. Bariatric care often involves specialized equipment for residents with high body weights. Question 2. What is the largest organ in the human body? Option A, the heart. Option B, the brain. Option C, the skin. Option D, the liver. The correct answer is option C, the skin. The skin provides protection, temperature regulation, and sensory input for the entire body. Question 3. How many bones are in the human body? Option A, 100. Option B, 206. Option C, 350. Option D, 500. The correct answer is option B, 206. The skeletal system provides the framework and support for all other body systems. Question 4. What are the two upper chambers of the heart called? Option A, the right and left ventricles. Option B, the right and left atria. Option C, the arteries and veins. Option D, the valves. The correct answer is option B, the right and left atria. The atria receive blood returning to the heart from the lungs and the rest of the body. Question 5. Which blood vessels carry blood away from the heart to the rest of the body? Option A, veins. Option B, capillaries. Option C, arteries. Option D, venules. The correct answer is option C, arteries. Arteries have thick, muscular walls to handle the high pressure of blood being pumped by the heart. Question 6. The brain and the spinal cord make up which system? Option A, the peripheral nervous system. Option B, the central nervous system. Option C, the autonomic nervous system. Option D, the skeletal system. The correct answer is option B, the central nervous system. The central nervous system is the primary control center for the entire body. Question 7. Which system is responsible for the fight or flight response? Option A, the parasympathetic nervous system. Option B, the sympathetic nervous system. Option C, the digestive system. Option D, the integumentary system. The correct answer is option B, the sympathetic nervous system. The sympathetic nervous system prepares the body to react to stress or danger. Question 8. What should you do if a resident starts to fall while you are walking with them? Option A, try to catch them and hold them up. Option B, run to get a chair. Option C, ease the resident to the floor. Option D, scream for help and let go. The correct answer is option C, ease the resident to the floor. Easing the resident down prevents a hard impact and protects the assistant from back injury. Question 9. In the event of a fire, what does the letter R in the acronym RACE stand for? Option A, run away. Option B, ring the bell. Option C, rescue. Option D, relocate. The correct answer is option C, rescue. The priority is to rescue any residents in immediate danger from the fire. Question 10. What is the first thing you should do when finding a conscious client lying on the bathroom floor? Option A, help them up immediately. Option B, call for assistance from the nurse in charge. Option C, give them a drink of water. Option D, put a blanket over them and walk away. The correct answer is option B, call for assistance from the nurse in charge. The resident should not be moved until a nurse assesses them for internal injuries or fractures. Question 11. To be sure that a client's weight is measured accurately, when should they be weighed? Option A, at the same time of day. Option B, whenever the assistant has time. Option C, right after they eat a big meal. Option D, with their heavy winter coat on. The correct answer is option A, at the same time of day. Weighing at the same time and in similar clothing ensures that weight trends are accurate. Question 12. What is the term for the stiffening of skeletal muscles that occurs after death? Option A. Rigor mortis. Option B. Homeostasis. Option C. Peristalsis. Option D. Atrophy. The correct answer is option A. Rigor mortis. Rigor mortis begins a few hours after death and is an important consideration in post-mortem care. Question 13. Inside the lungs, where does the actual exchange of oxygen and carbon dioxide take place? Option A. The trachea. Option B. The bronchi. Option C. The alveoli. Option D. The pleura. The correct answer is option C. The alveoli. Alveoli are tiny air sacs with thin walls that allow gases to pass into the bloodstream. Question 14. What is the most common mental health disorder among the elderly population? Option A. Schizophrenia. Option B. Bipolar disorder. Option C. Depression. Option D. Paranoia. The correct answer is option C. Depression. Depression in the elderly is often underdiagnosed but is highly treatable with proper care. Question 15. Which of the following is a symptom of low blood sugar, also known as hypoglycemia? Option A. Extreme thirst. Option B. Sweet-smelling breath. Option C. Shakiness or trembling. Option D. Frequent urination. The correct answer is option C. Shakiness or trembling. Hypoglycemia requires immediate treatment with a fast-acting source of sugar. Question 16. A prosthesis is defined as which of the following? Option A. A type of medication. Option B. An artificial limb or body part. Option C. A special type of diet. Option D. A medical insurance plan. The correct answer is option B. An artificial limb or body part. Prosthetics help residents regain function after the loss of a natural body part. Question 17. The term NPO stands for which medical instruction? Option A. New patients only. Option B. Nothing by mouth. Option C. Normal pulse only. Option D. Nighttime positioning only. The correct answer is option B. Nothing by mouth. NPO is a common order before surgery or when a resident is suffering from severe nausea. Question 18. The nurse aide is changing a resident's soiled bed linens. Where should the nurse aide place the dirty linens? Option A. On the floor next to the bed. Option B. On the bedside table. Option C. In a leak-proof laundry bag. Option D. On the chair in the room. The correct answer is option C. In a leak-proof laundry bag. Soiled linens are considered biohazards and must be placed immediately in a leak-proof bag to prevent the spread of microorganisms. Question 19. Which of the following is the best way to prevent the spreading of germs? Option A. Wearing gloves during patient care. Option B. Wearing a mask and gloves during patient care. Option C. Hand washing before and after patient care. Option D. Wearing a gown, mask and gloves while performing patient care. The correct answer is option C. Hand washing before and after patient care. Hand washing is the single most effective method for preventing the transmission of pathogens and cross-contamination in healthcare settings. Question 20. Which of the following is an example of subjective information? Option A. The patient's pain level is 7/10. Option B. The patient's temperature is 101.2. Option C. The patient's respirations are 18 bpm. Option D. The patient's blood pressure is 120/80. The correct answer is option A. The patient's pain level is 7/10. Subjective information is based on what the patient reports and cannot be independently measured by the aide. Pain is always subjective. Question 21. The nursing assistant is caring for a patient who is a two-person transfer assist. She plans on using a Hoyer lift because she is in a hurry. The assistant brings the lift into the room and the resident asks, "Are you going to get someone to help you?" What should the assistant tell the patient? Option A. No, I am in a rush, you will be okay. Option B. Yes, I will get another CNA to help. Your safety comes first. Option C, explain to the patient that you will be extremely careful. Option D, tell the patient you will get help but it will take a while. The correct answer is option B. Yes, I will get another CNA to help. Your safety comes first. Facility safety protocols for mechanical lifts almost always require 2 staff members. The aide must prioritize the patient's safety over their own schedule. Question 22. The nursing assistant is caring for a patient who is on a bowel regimen and has not had a bowel movement in 4 days. What is the assistant's next step? Option A, report this to the nurse in charge. Option B, give the patient orange juice with Miralax. Option C, encourage the patient to drink more water. Option D, nothing. This is normal. The correct answer is option A. Report this to the nurse in charge. A change in bowel habits or a lack of bowel movements for several days is a significant finding that must be reported to the licensed nurse. Question 23. The aide is caring for a patient on strict dysphagia precautions. The cafeteria sent her up a lunch tray. What item would the aide question if it arrived on the patient's tray? Option A, regular orange juice. Option B, mashed potatoes. Option C, oatmeal. Option D, applesauce. The correct answer is option A, regular orange juice. Dysphagia indicates difficulty swallowing. Thin liquids like regular orange juice are high choking risks and require thickening agents. Question 24. The patient is lying in the supine position. In what position is the patient's bed? Option A, the head of the bed is 90 degrees. Option B, the head of the bed is flat. Option C, the head of the bed is tilted backward 30 degrees. Option D, the head of the bed is 45 degrees. The correct answer is option B, the head of the bed is flat. The supine position refers to the patient lying flat on their back with the bed horizontal. Question 25. What is one reason why performing postmortem care is essential? Option A, there is no need to perform care. Option B, performing care ensures the staff feel good. Option C, one reason care is essential is that it is legally required. Option D, care is important to maintain the dignity and respect of the patient. The correct answer is option D. Care is important to maintain the dignity and respect of the patient. Postmortem care is provided to show respect for the deceased and to provide a clean and peaceful appearance for the grieving family. Question 26. The nurse aide is assisting a resident with ambulation. This patient uses a cane for ambulation. How should the nurse aide assist this patient? Option A, stand on the same side as the cane. Option B, stand on the patient's weaker side. Option C, stand behind the patient in case they fall. Option D, walk backward in front of the patient. The correct answer is option B, stand on the patient's weaker side. When assisting with ambulation, the aide should stand on the patient's affected weaker side to provide support and balance. Question 27. The aide is caring for a patient who says, I overheard the nurse telling my roommate he has cancer. Is he going to be okay? How should the aide respond? Option A, his condition is confidential, I cannot share information. Option B, tell your patient what type of cancer his roommate has. Option C, you should ask his nurse what is wrong with him. Option D, ask your roommate's family member about his diagnosis. The correct answer is option A. His condition is confidential, I cannot share information. Under HIPAA regulations, a nurse aide cannot disclose the medical information of one resident to another. Question 28. A resident is hitting and kicking the 2 CNAs who are trying to provide care. What is the next step? Option A, tie the patient's hands to the bed with towels. Option B, yell for the nurse to bring a sedative. Option C, one CNA stays in a safe place and the second CNA gets help. Option D, tell the patient they better stop hitting and kicking. The correct answer is option C. One CNA stays in a safe place and the second CNA gets help. If a resident becomes combative, the aide should ensure safety, stop care, and seek assistance from the nurse. Question 29. The nurse aide is assigned to measure a resident's urinary output from the Foley catheter. Which action is most important to prevent the spread of infection? Option A, hold the drainage bag above the level of the bladder. Option B, wear gloves and clean the drainage tube after use. Option C, place the measuring container on the floor under the bed. Option D, rinse the measuring container with cold water before use. The correct answer is option B. Wear gloves and clean the drainage tube after use. Standard precautions in cleaning the drainage port prevent the introduction of bacteria into the closed urinary system. Question 30. A client's blood pressure measure is 200/180 but they appear stable and are not in distress. What should the CNA do next? Option A, ensure the blood pressure cuff is the correct size. Option B, document the blood pressure and finish other vitals. Option C, immediately notify the nursing supervisor. Option D, tell the client their blood pressure is too high. The correct answer is option C. Immediately notify the nursing supervisor. A blood pressure of 200/180 is a hypertensive crisis. It is a medical emergency that must be reported immediately. Question 31. The CNA witnesses a resident screaming at a coworker. What should the aide do next? Option A, yell at the resident to stop. Option B, call the charge nurse. Option C, apply restraints. Option D, nothing, it is not your problem. The correct answer is option B. Call the charge nurse. Behavioral issues and verbal aggression should be reported to the charge nurse for appropriate intervention. Question 32. Bedmaking technique includes eliminating wrinkles in the sheets. The CNA knows this technique assists to: Option A, prevent pressure sores. Option B, ensure the client is warm. Option C, minimize the need to remake the bed. Option D, provide improved hygiene. The correct answer is option A. Prevent pressure sores. Wrinkles in bed sheets create friction and uneven pressure, which are leading causes of skin breakdown. Question 33. Which of the following happens when a patient has a stroke? Option A. The patient urinates themselves. Option B. The patient may foam at the mouth. Option C. The patient may roll their eyes back. Option D. The patient may have drooping of one side of the face. The correct answer is option D. The patient may have drooping of one side of the face. A common and immediate sign of a stroke is hemiplegia, often visible as unilateral facial drooping. Question 34. Which task is correct foot care for a diabetic patient? Option A, giving the patient a heating pad for his feet. Option B, soaking his dry feet in a warm tub daily. Option C, keeping his feet dry and warm with clean socks. Option D, ensuring his toenails are always clipped short. The correct answer is option C. Keeping his feet dry and warm with clean socks. Diabetic patients often have poor circulation. Keeping feet clean and dry is essential to prevent infections. Question 35. The nurse aide is caring for an 85-year-old woman with a UTI. Which change associated with a UTI in the elderly would the CNA report to the nurse? Option A, increased thirst. Option B, sudden confusion. Option C, low back pain. Option D, darker urine. The correct answer is option B, sudden confusion. In the elderly, classic symptoms of infection are often absent. Sudden onset of confusion is a frequent indicator of a UTI. Question 36. You are assisting a diabetic patient with eating and he only finished 25% of his meal. What should you do? Option A, report this to the nurse in charge. Option B, nothing, the patient may not be hungry. Option C, tell the patient they must eat more. Option D, chart the patient ate 25% of the meal. The correct answer is option A. Report this to the nurse in charge. Diabetic patients require consistent carbohydrate intake to balance insulin. Low food intake must be reported. Question 37. The CNA was unable to empty a urinary bag until the end of a 12-hour shift. Which amount emptied should be reported immediately? Option A, 1,000 ml. Option B, 600 ml. Option C, 2,100 ml. Option D, 350 ml. The correct answer is option D, 350 ml. Normal urine output should be at least 30 ml per hour. Over 12 hours, 350 ml is significantly low.